Hello, everyone. My name is Helen Palomino. I'm a licensed clinical social worker and CEO of the Cancer Resource Center of the Desert, which is located about 2 hours east of here in the rural desert on the U.S.-Mexico border. And because we're medically underserved, we are an agency of social workers. We function as clinical patient navigators, practical patient navigation. And for about the last 6 years, we've been working with Dr. Irene Sue with our working with the California Breast Cancer Research Program funded as co-PIs in looking at how to help women with breast cancer and in their health, the women's health, specifically addressing fertility preservation needs. So my perspective on helping as a financial navigation, and our financial navigation comes from the perspective of patient navigation, which is centered on helping from the perspective of the individual. So we as social workers are very aware of the distress someone has when they're diagnosed with cancer. And in our area, it is very palpable because of the low literacy rate many times. And we are also working with other tertiary centers that Dr. Sue is engaged with in offering financial navigation. So we approach it really from the perspective of the patient to find out what it is they are wanting if they want to have a baby in the future. So when someone is diagnosed with cancer, of course, time is of the essence. They're under pressure to start their treatment. They're scared. They barely understand what's happening. And if they do have commercial insurance with the possibility of having that covered, that's great, but they don't understand it. And so one of the things we want to look at is, even though time is critical, it's not a fast turnaround. It takes long to try to figure out, are they covered? If they're not covered, what are those out-of-pocket costs? How do we mitigate those costs? So we look at it in a way where we are trying to assist bringing in those resources in a very fast and effective manner. So the cost, which is staggering for many people, if it's for sperm preservation, out-of-pocket cost that's not covered by the insurance could easily be $1,200. If it's for egg retrieval and it's not covered, $10,000. So what do you do with that? You're facing cancer. You want to have a baby. You don't have any money. You don't know if you're covered or if you are covered, all of those things. It's a very difficult space to be in. So one of the things we do encourage, if they are not already doing so, is that Oncofertility consult. It's critical because a plan is established on what they're eligible to have fertility preservation plan. And then the exploration on what's covered, what's not covered, all that eligibility, so it can be honed and time managed properly. The other thing that people are faced with is the expense. How are they going to pay for that? So we have to find creative ways to help people pay for this. And as have been mentioned before, persons can be given a list. People can be given a list of, who to call, what agency, what foundation can cover what. It's so cumbersome and it's not easy, and the need is immediate. So to me, I always felt there's a gap. People need money up front. I would love to be a foundation that can give them money on the front end. That's my dream, but I hope that that happens and comes to fruition. So those are the creative ways we are trying to look at covering those preservation needs. Self-advocacy, especially when it comes to insurances, is really important for them to understand what their insurance coverage is. And they need to know who to speak to, what to ask for. Shannon is amazing. She's helped our team. She's helped to train our team for financial navigation. And it's so challenging if it was left to someone to fend for themselves in trying to figure this out. It is so wrong, I think. But the individuals need to understand their coverage and how and what to ask for. Are the prescriptions covered? What's involved? And they don't know. So involving a financial navigator in this process is so helpful and beneficial because the navigator has a little bit more broader access points to try to find out information. And so being able to go into the portal from a perspective on the on the medical side is helpful. And so it's very important and supportive as a financial navigator to help. We approach helping cancer patients from a very holistic and culturally sensitive perspective. That's why our patient navigation influences that financial piece, because many people don't speak English, or they don't understand, they don't have the health literacy of the system or their body or their health diagnosis. So our goal is to help them access and move quickly with moving forward with providing that support, translation services, and also wraparound services. If we cannot find monies to that a foundation can provide specifically for fertility preservation, let's find it according to their cancer diagnosis. There's funds available for that. If not that, how can we save them money, enrolling them into programs that bring them savings? So we did have a patient that had Medi-Cal that doesn't cover egg retrieval, and it was a woman. So we were able to, she was eligible for ovarian tissue transplantation, cryopreservation, and she did have out of pocket. And we were able to activate another program within her county to access practical needs, save her some money, and they were able to help her and within the language that she spoke. So as we move forward, it's very critical that as a community partner, one of the and advocating for our patients, we are involved with helping with our policy recommendations. And I think the immediacy of meeting the financial needs of fertility preservation is critical in a comprehensive way. I hope that happens. Research-wise, I think as academic partners who are always looking for community partners, that they would consider during that preparation process that it would be a mutually beneficial partnership and consideration, that there would be comprehensive support on both sides, because we still have a job to do while we do our research, and it has been a pleasure doing this work. Thank you.